This is a combined case of operation with the Malar lipostructure and lipostructure temporal area, 1.5 cc in the lip, blepharoplasty and retouch of the nose tip. And here you can see the result, and also the result of the lower lid with a good result in the external area, but probably we need some fat in the internal area. And I do it many times with injection with Coleman microcannula 19 gauge, and like in this case, a malar and lower lid lipoatrophy with a lipofilling with solution system. I injected 12 cc in the malar area and 1.5 cc in the lower lid, and you see the result without any blepharoplasty. Just to show you two cases when you need to resolve the problem in the lower lid with only lipostructure, and with 2 cc I injected this area in the deep plane, and you see the result of the lower lid, and also in this case the result with only 2 cc each side of fat. This is a case of Romberg disease with this kind of problem, and I perform a Coleman technique with 27 cc of lipostructure. Here you see the project, all the area I've injected, and here you see the result, but in this way you can see the result how we have the volume restored of the face with only fat. Of course, we can use the malar augmentation in combination with the facelift, and I used to do this at the end of the lifting, and here you see moment of the procedure, at the end facelift with the malar augmentation and lip augmentation with the lipofilling. A case of facelift with lipostructure, and now it's in my hand. I use the lipostructure in many parts of the cases of lifting, and here it's only 10 cc each side. Another case in facelift and malar and temporal lipostructure with 6 and 3 cc. And here you see the amount of volume, because many times we need to put volume in the malar area instead of the lifting, conservative lifting, and 10 cc of lipostructure, Coleman technique. You see the result of the improvement of the skin quality, like in this case, a lifting and hamra, repositioning of the fat in the lower lid, 7 cc malar area and 3 in temporal area, and you see probably better in this lateral view the quality, the improvement on the skin. It's very good. Another case, and I do a conservative lifting, and I use the fat grafting to resolve this problem of volume, and to resolve also this scar of Teflon. The patient has an injection of Teflon 20 years ago, and so you see how the fat resolved the problem of the scar and the skin quality. Another case of conservative lift and malar augmentation, 1 year post-op, and the front view of these cases with only 5 cc of fat. When I do the lifting, only few cc of fat give us the very good reshaping of this area, like in this case. This is a malar lipostructure and facelift and AMRA technique for the lower lid, repositioning of the fat in this lower part. And this is a special case, but only for me, because it's my old mother, and I performed last year this lifting, and of course putting 12 cc of fat lipostructure with Coleman technique. And any case I perform this kind of operation, lifting or only malar structure, I ask to the patient, of course, and my mother too, to give me a picture when they were young, just to have the idea how was the volume of the face when the patient was 20, 30 years old. Of course, I use malar implant and terino-malar shell implant, and in this case, I use the terino-malar implant because the depression was very important, but in the same time, I use 6 cc of lipostructure and facelifting, and here you see the result at 8 months, but also a stable result in 33 months post-op, and you see the good improvement of the quality of the skin with the lipostructure without any kind of laser treatment. And malar lipostructure and facelift with 7 cc each side, and this result and this malar augmentation with Coleman technique again. And the old one I have in the facelift with total lipostructure 35 cc each side. After 5 years, we have this kind of result, and we have again still a good volume of the malar area. So of course in the last years, last year I introduced the solution lipofilling in my technique, and it's only 60-month follow-up in my end. Of course, we need a big amount of fat that is required from this technique, and probably this technique give us a fat too wet, so it's very important to have the pure graft bag, probably to have a very drier fat. In any case, it's a long and expensive procedure. You see the enzyme, the device, what we have to do. We have a big amount of fat, and it's normal. We use only 10, 20, 30 cc maximum in the face, and this technique now it's available for much more volume of fat. Any case, I want to show you some cases of solution lipofilling, full face. This was an HIV Wet syndrome lipoatrophy treated with 35 cc each side. And another case of solution lipostructure with 7 months post-op, a full face with 17 cc each side. And another case again with solution face chasing with 19 cc each side. And of course we have a very good improvement again of skin quality, and I think it's very important for you that understand lipostructure is a simple and safe and easy and can correct every malar depression. The technique is mini-invasive, and it can be done in ambulatory many times in only local anesthesia. And I use less use of malar implant, of course, and then fat grafting is used to reestablish the face volume every time we do aging correction. Fat grafting for every little correction in the face now is the procedure I use, and I avoid filler every time I can. And with cell-enriched fat, we can have the best result in terms of volume and quality of the skin, even if we need a device that can work with a few amount of fat and give us a drier fat. Thank you.